Today on the Transplant Helper, we're going to be talking a little bit about your medication side effects post-transplant and some of the anxiety, the dread, maybe even the hesitation that you might have in getting a transplant because you know the side effects are going to be so bad in the end. Stay tuned.
Hit the subscribe button and the bell notification to become part of the Transplant Helper community.
Hey folks, welcome back to the Transplant Helper again today. My name is Jim Merle, and I've got a question here from a great friend of the program, one who's asking really about some of the side effects that come after transplant along with the medications, and basically, I think in a nutshell, is saying, is it actually worth it? Here's the comment here. It comes from Sir Bats. It says, hey, I love your channel and the info you give. Also, I like hearing your opinion. I need a kidney, but I have hesitated because of all the meds that come after. I'm afraid of the side effects. I once had to take prednisone and cyclosporine, and with those two, they cause gout attacks. About a year after that, the meds destroyed my hip, which caused me to have a hip replacement. Do you take a lot of meds now, and do you have side effects from them? I think that's a great question, and I can remember pre-transplant as I was kind of getting into the process, learning a little bit about it, especially when they were sitting down with me and being honest in the pharmacy about some of the medications I would be taking post-transplant. I was a little bit anxious about it, and like you, kind of hesitated, wondered if it would all be worth it. But anyway, with that being said, let's talk a little bit about the main medications you may be taking post-transplant. And it really doesn't matter whether you're getting a heart, lung, liver, kidney, pancreas transplant, whatever. Most of the transplant patients are going to start out on medications something similar to this. Now, there are basically three of the main medications you might be on. We'll mention a couple more in a moment. But the very first one, and most importantly, you're probably going to be on a medication called Prograf, also known as Tacrolimus. I like to call it Tacrolimus. It's Tacrolimus. But anyway, that's just the generic versus the name brand form of that. That is one of your major anti-rejection drugs, one which oftentimes does cause quite a bit of side effect, and it is one of those that's kind of difficult to get the levels adjusted in the beginning. As a matter of fact, they're going to take a very specific blood panel on you that looks directly for the level of that medication in your bloodstream, and it's really going to gauge how much of that medication you're going to have to take. Now, there are a lot of side effects that come along with the medication. Obviously, the major side effect is that your immune system is suppressed, and that's what it's supposed to do, so that's a good one. But that can cause a lot of problems. It can cause you to be really susceptible to potential infections, bacteria or viral type things. Typically speaking, within that first year, pretty much anything that's going around the family or around your community, yeah, you're going to end up getting it. Things like colds, flus, strep throat was pretty common for me. A lot of just stomach bugs, that sort of thing. You're going to be pretty susceptible to that. And again, that's because it is causing your immune system to be suppressed. Therefore, it's actually doing its job. It's just, as it suppresses your immune system for preventing rejection, it does add to it a little bit more potential for getting sick. Other side effects that come along with that medication, particularly the major one that people dread, are the tremors. And I mean by this is one of those types of things that's just really aggravating. Post-transplant, if you're one who eats a lot of, peas or beans or anything that's going to roll off a spoon, cereal, rice, for example, you're not going to be able to eat that as well because there's going to be a lot of tremors associated with that. Very aggravating. I used to think that if I sat down and just stuck my finger down in the glass of cola, some kind of Sprite or Coke or whatever, that it would just fizz out of there because you feel like from the inside out you're having a lot of tremors from that. And typically the Tacrolimus/Prograf, Tacrolimus, can cause that to happen. That's one of the major medications the large majority of us are on. Now, the good news is the level of that medication that you're on is going to come down pretty quickly as they do get that adjusted, as they do get that baseline set. And the lower the doses, the better you're going to feel. So you're going to get over that medication pretty quickly. You're probably not going to come off of it, however, not unless they change you to another medication like the one that was listed here in the statement question, the cyclosporin. You're probably going to stay on that. You're going to be on some form of that Tacrolimus, Tacrolimus, Prograf type thing. Anyway, that's your major medication. Secondarily to that, you're more than likely going to be on a medication known as mycophenolate or myfortic, and that's just, again, two derivatives of such. And depending on what your needs are as far as keeping you immune suppressed, and this is another one of those immunosuppressant type drugs, you're going to take various and different dosages of that. And more times than not, if there are side effects of that med, and there are, but it's typically going to come down to gastrointestinal type issues. So a lot of stomach issues, probably deal with a good bit of diarrhea, that sort of thing in the beginning. Maybe the opposite of that is true, constipation, albeit not as common. Going to be dealing with some gastrointestinal type issues. And if those issues persist and if they are severe, again, there are other options of medications they can put you on, but typically there's a level that's just kind of expected there, and you really just kind of have to deal with it. But the side effects, again, are present, and they can be quite aggravating or quite, restricting in some senses, and you can understand why that would be. The third medication you're going to be on most commonly, and this is probably going to be one of the most needed medications, albeit you may not think about it in the beginning, is you're going to be on the drug that you named in the comment. They're prednisone. Prednisone is one of those post-transplant medications that are really, really problematic. Now, mainly because prednisone comes with quite a bit of side effects. Things like high blood pressure can be present, things like headaches, things like fatigue, muscle weakness, anger issues, particularly really big mood swings are what are most complained about, and a high blood sugar. It can cause you to actually be somewhat diabetic or pre-diabetic in the beginning on the larger doses. Now, the good news of this medication, again, is the lower the dose comes, the better you're going to do, and the less of these side effects you're going to have. And in many cases now, and I'm glad this is 2020, in many cases now, they're actually getting people on the medication early, obviously, as they start you out in the beginning, but they're getting you off of it pretty early as well. I've seen several people here lately, for example, that are on the medication from the beginning, but they're back off of it by, say, 6 months. And not everyone gets off. There are some people who are maintained at what they call a maintenance dose of that, 5 milligrams for the rest of their life. And that's just going to be dependent on your situation. It's going to be judged by your team individually and your case individually. But nonetheless, it's one of those problematic drugs. And over time, and I've had several programs on this, I'll try to link some of them up here in the corners, maybe the description below the video. But oftentimes it can cause some damage to your pituitary glands and adrenal glands, I should say, not pituitary, but adrenal glands. And it can cause some fatigue that kind of persists on for a while, even after you get off that medication. And again, it is an anti-rejection type drug. It is actually one of the most important, albeit prednisone is a very cheap, very old drug that's been used for so many other things. It can cause some problems. It can also, added to that, cause some problems with bone density. This person mentioned having difficulty with bone degeneration, eventually having to have a hip replaced. I'm not saying that's going to happen to everyone. It's actually pretty rare, but it is common. There can be some osteoporosis type things that come over time. I'm dealing with that already. Osteopenia, I think is the word. Don't quote me on that. I think it's osteopenia. It's kind of a pre-osteoporosis type thing. You'll deal with it. And again, these medications, they just have side effects. Now, whether you're talking about the Tacrolimus / AKA Prograf, Tacrolimus, Mycophenolate, or the prednisone here in the last, all these medications do have their side effects and they do have their risk, but I think the benefit's going to outweigh that. We have to keep in mind and remember, and again, we know this, but whether you're a heart, lung, liver, kidney, pancreas, whatever type of transplant patient or failure patient in this case, pre-transplant, the potential outcome there can be a loss of life. Those are failures. Those are major organ failures. And so, I think in the end of this, the benefits will definitely outweigh the risk and definitely going to be worth it, albeit can be a little bit aggravating. And these will be medications, most of which you'll be on for a long, long time. But I think it's at the end of the day worth it. So yeah, if I was dealing with gout, I know how severe gout can be. That's problematic. Dealing with the osteoporosis, problematic. Whatever, you've dealt with it before. You've been there, done that. But I think in the end of it, it's going to be so important. There are other options, and there are some things they can try. Hopefully, they'll be willing to. Your team, I mean, and they'll get you straightened out. You'll be just fine. I really appreciate you joining me today. I appreciate being able to answer this question, or at least try to answer this question. By the way, if you've got any questions at all, feel free to reach out to me. You can comment below this video. You can find me over on Facebook at Jim Murrell. That's JIMMURRELL. You can send me an email at jim@thetransplanthelper.com, and I'll get back with you as soon as I possibly can and try to answer the question. I'll answer it back via message, clicking, texting, or whatever. I may make a video about it. You can't ever tell what I'll be able to do. But nonetheless, thank you so much for joining me. Until next time, each and every one of you, as always, stay stronger, friend.